Senator Cardin is next.
Thank you, Mr. Chairman, and let me thank all of our witnesses. I think this panel has been extremely helpful. This is an area, as you can tell by the questions, you don't know who the Democrats or the Republicans on the committee, that we have a mutual desire to try to get this right. And we recognize we have a real challenge in mental health in this country, but particularly with our youth, with the experiences of COVID-19, we know that we have a greater challenge than ever before. So I want to talk about the school setting for one moment, what we can do. I am responsible as one of the co-chairs of the groups that Senator Wyden has been talking about to deal with telehealth. And I'm curious, you've all talked about the importance of expanding telehealth, but what are the challenges within the school setting of expanding telehealth services? Where do we need to try to put our attention, either change of policy or resources, in order to expand the productive use of telehealth in the school setting? Either Dr. Hoover or whoever would like to respond to that, perhaps start with Dr. Hoover.
Sure, I'm happy to jump in. Thank you, Senator Cardin, for your leadership in this issue of mental health across the nation, and specifically in the area of parity and telemental health. We know telemental health has actually been in the schools for years. Our child psychiatrists were delivering telemental health across schools in Maryland and in Baltimore City back when I was delivering services in the early 2000s. We know that there are continued infrastructure improvements that are necessary to improve telemental health services in schools, and that would include enhanced broadband systems, up-to-date telehealth delivery equipment, internet connectivity services, especially to some of our rural communities. We know that policy expansion is important, including reimbursement parity for telemental health and expanded access to Medicaid and children's health insurance telehealth programs. So there's a number of areas that we've seen improvements in during COVID that we need to continue and to expand. And that applies to schools as well.
If I could get either your view or Dr. Benton's view, we made a lot of resources available to our school systems in response to COVID. Have they been used to expand the connectivity that you're talking about for mental health services?
Some have, and again, happy to defer to Dr. Benton here as well, but some have. One of the things we know, though, is that some of the COVID relief funding, for example, is creating kind of one and done or some hiring, short-term hiring fixes. But we know that it's critical to make some of these Medicaid policy adjustments so that we can allow for sustainable funding for telehealth and other mental health services. Dr. Benton?
Yes, I would concur with Dr. Hoover. I think many of the systems have used the resources well, but many of them were understaffed before the pandemic and did not have access to adequate resources. They've reached out for telehealth, but there are a variety of factors that impact their ability to optimize its use. Some of them are the privacy standards. So communications between mental health providers and schools through HIPAA and FERPA are issues that really need to be addressed in communicating about mental health concerns. Some schools may have one or two school counselors, but not necessarily access to a provider team of psychiatrists that can partner with the schools, as Dr. Hoover described, to provide that additional level of care that's not necessarily available in the schools. And then in addition to that, we do need to think about our care models very differently. So for example, there are services that are cheaper to set up that are available right now, such as school-based crisis services. So when a school is under-resourced and there's a crisis, it's very possible to send someone to that school to see that youngster on site with the family, or urgent cares that are on site at schools. So there's some other things that we could do to support our schools. So I thank you for your leadership in supporting the schools through the pandemic. We should retain those things, and there are other things that we could do to expand access.
So Dr. Benton, you've talked about the need to have improved screening in regards to mental health for our students. Can telehealth be helpful in dealing with screening, recognizing that you need personnel in the school itself, but can that be better utilized than we're using today for screening?
Yes, yes, Senator. That's an excellent recommendation. And yes, it would be very helpful. One of the challenges for schools is they screen and then they can't respond. And so having telehealth allows them to screen youngsters for problems or challenges before they become major problems. And telehealth can be used to address some of the more acute things on site. Currently, screening is not viewed enthusiastically because if you find something, you can't do anything about it. The utilization of telehealth to connect with a crisis provider would allow the school to be able to respond in a safe and effective way. And thank you for
Thank
that
you, Mr.
question.
Chairman. Appreciate the response.
Thank you, Senator Carper, and we appreciate your leadership on these issues as